Pause this video to read and understand that the content in this video is provided for informational purposes only. This video involves a lot of research and effort. Comment, rate and share. What foods improve your burnout state? Research has shown an inverse relationship between good nutrition and burnout, with healthier eating indicators associated with lower levels of burnout symptoms. Utter et al., 2023, Vertanen et al., 2022. Additionally, interventions to increase physical activity have been proposed to help improve the symptoms of burnout. Cecil et al., 2014. Furthermore, a study highlighted that the consumption of healthy foods was inversely proportional to the severity of burnout symptoms. Bakiran et al., 2022. It has also been suggested that combined nutrition and exercise strategies can reduce the likelihood of physician burnout. Ulagri et al., 2021. Moreover, educating medical students about lifestyle medicine early in their training and providing resources to support their wellness may mitigate burnout and promote resiliency. Rockfeld et al., 2020. It is important to note that chronic stress, such as that experienced by individuals suffering from burnout, can influence the types and amounts of foods individuals eat, contributing to the development of chronic diseases. Esquivel, 2020. Furthermore, weight loss, which often accompanies burnout, has been linked to limitations in food intake due to hypocortisolism, a typical characteristic of burnout. Zalewski and Makarastadzinska, 2022. Somatic symptoms found from burnout experienced by midwives included changes in food habits, indicating the potential impact of burnout on dietary habits. Rosiad et al., 2022. Frequent consumption of healthy food items is associated with a low level of burnout symptoms. Pentanen et al., 2021. Additionally, a study on child and adolescent tennis players found that there is a link between adherence to the Mediterranean diet and the risk of burnout syndrome, particularly in relation to the daily consumption of fresh or cooked vegetables. Paredes Costa et al., 2020. What exercises are good for burnout? Physical exercise has been identified as an effective intervention for reducing burnout. A systematic review by Neksensky et al., 2017, suggests that physical activity is effective in reducing burnout. This is supported by the findings of Gerber et al., 2013, who conducted a pilot study and found that stress management programs, including aerobic exercise, positively influenced the well-being of patients suffering from burnout. Furthermore, a study by Chen et al., 2022, indicated that physical exercise is an important interventional target for reducing academic burnout. Additionally, a randomized controlled trial by Vanajan et al., 2019, supported the effectiveness of a burnout prevention program, which included physical exercise, in reducing perceived stress and emotional exhaustion. The type of physical exercise also plays a role in reducing burnout. For instance, Zhu et al., 2021, found that mind-body exercise, Bajuanjan, may be considered an alternative strategy to reduce burnout and perceived stress in female undergraduate students. Furthermore, Tsai et al., 2013, found that exercise significantly reduced systolic blood pressure and improved personal and work-related burnout among banking and insurance workers. Additionally, the study by Vries et al., 2016, highlighted the value of low-intensity exercise for university students with high levels of study-related fatigue, indicating its potential in reducing burnout. While the evidence supports the positive impact of physical exercise on burnout, it is important to note that there is a lack of relevant interventional studies, as highlighted by Lee et al., 2020. However, the existing research suggests that physical exercise, particularly aerobic exercise and mind-body exercises, can be effective in reducing burnout and its associated symptoms. To address burnout, various relaxation and mindfulness techniques have been found to be effective. Research suggests that activities such as reading, taking quiet walks, and engaging in specific relaxation strategies like meditation can lead to lower levels of burnout and health complaints. Fritz and Sonnentag, 2006. Additionally, mindfulness-based interventions, including virtual reality (VR)-based mindfulness meditation, have shown promise in reducing burnout in real-world settings. Weitzman et al., 2021. Furthermore, meditation interventions have been found to effectively increase parental resilience and reduce parental burnout, particularly during challenging circumstances such as the COVID-19 pandemic. Liu et al., 2022. Moreover, mindfulness practices, breathing techniques, and yoga have demonstrated the ability to decrease stress and burnout, highlighting the potential of self-care practices in mitigating burnout. Petronas and Staffolino, 2021. Cognitive behavioral therapy, CBT, stress-reducing activities such as mindfulness, and group activities have been recommended as methods to manage burnout and increase productivity in hospitals. Patel et al., 2019. Additionally, mindfulness has been associated with improvements in occupational self-compassion and well-being, as well as reductions in anxiety, depression, stress, and burnout among teachers. Braun et al., 2018. Furthermore, mindfulness and self-leadership strategies have been shown to enhance psychological capital, reduce burnout, and increase engagement. Katza, 2021. Lifestyle medicine interventions, including stress reduction through mindfulness, exercise, food choices, and adequate sleep, have been identified as potential strategies to prevent or slow down the progression of stress to burnout. Merlo and Rippey, 2020. Finally, mindfulness-based strategies have been recommended for music educators to manage symptoms of burnout and increase well-being. Verona, 2018. What alternative therapies improve the state of burnout? To address burnout, various alternative therapies have been explored to improve the well-being of individuals experiencing this condition. Mind-body modalities such as yoga, mindfulness, and stress reduction programs have shown promise in alleviating burnout symptoms. For instance, a study reported that yoga significantly improved emotional exhaustion and depersonalization, which are subscales of burnout. Jung et al., 2021. Additionally, mindfulness interventions have been found to reduce burnout among healthcare professionals, with evidence suggesting that burnout negatively affects patient care. Fortney et al., 2013. Furthermore, stress reduction techniques including Reiki, yoga, and meditation have been shown to decrease exhaustion, improve levels of self-care and care of others, and decrease stress, fatigue, and burnout. Dable et al., 2015. Moreover, mindfulness skills improvement using a mindfulness-based intervention has been linked to reducing burnout symptoms. Kinnunen et al., 2020. These interventions have also been associated with improvements in stress, mindfulness, and resilience, which were linked to decreased burnout and increased confidence in providing compassionate care. Kemper et al., 2017. Furthermore, mindfulness-based interventions have been identified as effective in reducing stress and burnout in nurses working in acute settings, Armstrong and Turn, 2022. Additionally, acupuncture treatment has been found to be highly effective in addressing burnout dimensions, with identified epigenetic targets involved in major disturbances of this syndrome, Petit-Pierre et al., 2021. In conclusion, alternative therapies such as yoga, mindfulness, stress reduction programs, Reiki, and acupuncture have shown potential in improving the state of burnout. These interventions have demonstrated effectiveness in reducing emotional exhaustion, improving self-care, decreasing stress, and enhancing resilience, thus offering promising avenues for addressing burnout. The prevalence of burnout varies across different specialties and regions. The state of burnout is a prevalent concern across various professional domains, including medicine, nursing, and athletics. Research indicates that burnout is influenced by a multitude of factors, such as workplace empowerment, incivility, workplace bullying, and social capital. For instance, emphasize the impact of empowerment and incivility on nurses' experiences of burnout, suggesting that managerial strategies empowering professional practice may prevent workplace incivility and burnout, Leischinger et al., 2009. Additionally, workplace bullying was found to contribute to negative feelings, impacting physical and psychological health, thus potentiating burnout, Ribeiro et al., 2021. Furthermore, strategies to enhance workplace and community social capital were identified as beneficial in preventing burnout among health and social welfare professionals, Murayama et al., 2020. The prevalence of burnout varies across different specialties and regions. For example, assess the prevalence of burnout among resident physicians in Jordan and identified gender, working hours, psychological distress, training sector, and specialty as risk factors associated with burnout development, Nimmer et al., 2021. Moreover, a meta-analysis conducted by revealed varying prevalence rates of burnout among medical and surgical residents, with psychiatry, oncology, and family medicine showing the lowest prevalence, Lowe et al., 2019. Also conducted a meta-analysis, indicating a significant number of nurses with moderate to high levels of burnout over the last decade, Gu et al., 2023. Furthermore, workplace factors such as workplace bullying, organizational processes, and avoidance and withdrawal at work were found to increase burnout among perioperative nurses in Australia, Lang et al., 2021. Additionally, traumatic stress experienced by Japanese midwives was identified as having a significant impact on burnout and work engagement, Kubota and Horiuchi, 2022. In conclusion, burnout is a complex phenomenon influenced by various factors such as workplace empowerment, incivility, workplace bullying, and social capital. The prevalence of burnout varies across different specialties and regions, and it is crucial to address workplace factors and individual well-being to mitigate its impact. When experiencing burnout, it is crucial to address it effectively to prevent negative consequences. Research suggests various interventions to reduce and prevent burnout. Individual interventions such as mindfulness, stress management, and small group discussions have been found to be effective in reducing burnout, Rich et al., 2020. Additionally, Meditation-based interventions have shown potential in decreasing burnout and improving satisfaction with life, Gupta et al., 2022. Furthermore, appropriate identification and intervention of dysfunctional coping strategies may be beneficial in reducing burnout risk, Minaldi et al., 2023. Organizational measures are also important for preventing burnout syndrome, but providing professionals with coping strategies is equally essential, Gomez-Gaskin et al., 2013. Moreover, healthcare managers have an ethical duty to create healthy organizations that reduce burnout, especially within critical settings such as oncology, Bonetti et al., 2019. Research also supports allowing time away from a stressful healthcare environment to promote wellness and decrease burnout, Soper, 2022. It is important to note that burnout can have significant consequences, including reduced productivity and quality of care for patients, Askey-Jones, 2018. Furthermore, burnout can affect people at all levels, including service providers, clients, and organizations as a whole, Kangern et al., 2022. Effective coping strategies can reduce the impact of stressful situations on physical and mental health by building strategies to shield against burnout, Andrade et al., 2023. In conclusion, addressing burnout requires a multifaceted approach that includes individual interventions, organizational measures, and ethical responsibilities of healthcare managers. By implementing these strategies, it is possible to mitigate the negative effects of burnout and promote overall well-being in professional settings. Free newsletter and other benefits like references. Send email to medexinate@gmail.com. Write me your opinion in the comments about the topic and propose your next topic so I can read it. The most voted will be appreciated. Thanks for your time. Like, subscribe, write a comment about your opinion or propose a topic. Share it. Follow us on our social networks.